Hi, we are the founders and CEOs of Cuterus from the UCI Shoe Program, and my name is Rania Sani.
My name is Shreya Saleh.
My name is Zoe Ann.
My name is Michelle Notice.
My name is Alexis Waldron.
My name is Elisa Martinez, and today we will be talking about
Painful periods! And these are the most searched questions about painful periods on Google. Our first question is, what is a period? A simple definition of a period is a cyclic expulsion of blood, and sometimes tissue called endometrium, from the inner lining of the uterus. It is typically about 28 days long and involves multiple steps. The cycle starts with menstruation, where bleeding is experienced from about 5 to 7 days. This is a part of the follicular phase where the ovary prepares for ovulation. Around day 14 of the cycle, an egg is released from the ovary after the brain sends a high amount of hormone, LH, to stimulate ovulation. Finally, the luteal phase occurs where progesterone levels increase, which help transform the lining of the uterus from proliferative to secretory. This process repeats continuously.
Okay, our second question is, why am I experiencing PMS symptoms? During your period, most people experience common symptoms such as cramps, headaches, acne, nausea, and back pain. This is caused when the estrogen and progesterone levels rise and then drop during your menstrual cycle. Prior to bleeding, a hormone called prostaglandins is involved in pain and inflammation, which trigger the uterus to contract, creating cramps. The higher the prostaglandins are, the more severe your cramps will be. Prostaglandins can also cause diarrhea and nausea.
Our next question is, what are painful periods? Painful periods are also known as dysmenorrhea, and it is basically pain women experience during a menstrual cycle. This pain is usually located in the lower abdomen and can radiate into your inner thighs and back. Around 80% of women experience dysmenorrhea, and it is the most common gynecological problem of all women regardless of race and age. Risk factors include younger ages, smoking, stress, and genes. Dysmenorrhea usually resolves after childbirth.
Okay, so the next question is, what is the cause of pain during my menstrual cycle? Painful periods have two main causes. One is hormonal and the other is structural. Hormonal pain can be characterized as primary dysmenorrhea, meaning it comes with having your first period and presents more in younger women. If the cause of your pain is hormonal, it is because the ratio of prostaglandins is unbalanced. With unbalanced prostaglandins, there is an increased cramping in the uterus. Structural period pain, on the other hand, is secondary dysmenorrhea and has a couple of different causes. The first one is endometriosis, which is when endometrial cells from the uterus actually leave the uterus and end up in the abdomen, causing bleeding, scar tissue, and pain. The second one is fibrosis. This is when balls of muscle form inside the layer of muscle in the uterus, causing cramping to be more extreme.
Next question is, what is the diagnosis? So there are multiple methods to find the correct diagnosis for painful periods. Primary dysmenorrhea is when painful periods start with the first period, and there's no specific test to diagnose it. When it is predicted that fibroids or adenomyosis is causing the pain, physicians may schedule an ultrasound or MRI, which can give a detailed image of the duplicated mesocells enlarging throughout the uterus. If endometriosis is suspected to be the cause, physicians may perform a laparoscopy through minimal-sized incisions near the belly button. It allows for a camera to be inserted while also gaining access to more detailed information.
Okay, so our last question for today is, what are my treatment options?
Go.
The treatment option depends on what type of period pain you are having. A non-hormonal treatment option is Tylenol, which blocks pain receptors to help increase uterine pressure. There is also ibuprofen, which is a non-steroidal anti-inflammatory drug, which helps with redistributing the prostaglandin ratio. Hormonal treatment options are birth control pills, patches, vaginal rings, and IUDs. Surgical treatment to improve fibroids or endometriosis can help improve pain. A removal of the uterus may also be necessary in certain situations.
We're Cuterus, and this has been Wired's autocomplete Google search.
Thank you! And that's on period.
is, what are painful periods?
Give me a second.
So, what is the cause? Ma'am.
What? She goes, well. Okay, over. Sorry, I just ruined the whole thing. Okay. Okay, I'm also too close to everybody. Okay, I started. Whenever you're ready.
Okay, so how are we gonna hold this? Like, are we gonna like not?
No,
hold it?
that's not going to be in the frame. We can probably get rid of that.
Yes.
Okay, so our last question for today is, what are my? Oh my God! Cut!
And that's on period.
Oh my God!
Wait.
Go.
That's on period.
Oh my god.